What is Caesarean section all about?
It is a major surgical procedure, and the aim is to deliver a woman of a live baby. Now, I just put the word live there, but actually it is majorly to deliver a baby from the womb of a woman. A term baby. That's Caesarean section.
Okay, what are the factors that are unavoidable to choose Caesarean section?
Now, this is where it comes to play. Now, for majority of cases, they are done at emergency level, meaning that someone had been in labor, or there is situations prevailing that may make the doctors to avoid going through labor. Let's talk about the labor part. During labor, you expect periodic contraction. When the uterus contracts, you expect the presenting part to move down through the pelvis of the woman, what I call the funnel, the waist, go down and then pass into the vaginal vault and then comes out.
Naturally,
that's a vaginal delivery that we talk about. If there is any reason why this process is not completed, either number one, the passenger, the baby, is not properly positioned, or the passenger is bigger than the passage. So if you have a problem with these two, you may abort that process. Number two, if the passage is small or has bony spears that are not allowing easy transition of the baby from the womb out, you abort that procedure. If the mother carrying the baby has medical reasons by which she may not proceed any longer, for instance, high blood pressure, maternal exhaustion, severe pain in between contraction that may paint a picture of an imminent rupture, tearing of the uterus during the process, you also abort that procedure. So these are reasons, by reason of labor and emergency, that will make someone go for a cesarean section. Number two, if someone has had the C-sections twice, then such a person is no longer advised to labor. Whatever reason why it was done twice, you're no longer allowed to labor. Now, what allows the passenger to have easy transition? Liquor. Liquor is the water surrounding the baby. If at any time this liquor is completely out and the process of labor has not even commenced, that may pose some health risk for the passenger. You may suggest that you abort the process of labor and deliver our abdomen. Right.
Let's talk about the evolution of C-sections.
Yes. You know, it's called C-section because it was first performed on Caesar. So exactly back then, the Roman Empire. That's why it's called Caesarean section. So it has been for as long centuries ago. Yes. And a lot of time in those days, women die during the process of labor. And it is assumed that the gods called them. But when science started, and science comes first from thinking, you start thinking, are there no other ways to go about this? Must it come through this one way? And then at that point, you see people going after animals, studying animals. Yes, we've seen people study humans, but laws came out that you don't use humans as experiment without their consent and then without respect for humanity. So people now started using animals to study. I hope you're aware that animals too undergo Caesarean section. Yes, so that was where they were studied absolutely and realized that, so this is possible. You can cut them open, get to where these babies are, and then get the babies out and then stitch them just the way you went in. So in the process of studying, you observe how many layers you have to go through from the skin, which is 7, from the skin to the uterus. So you go through the 7 layers one by one, and then you get to where the babies are, get the baby out, and then you stitch that way back up. So that's what led to where we are today. So cesarean section has become popular today for these few reasons. One, people are now much aware that they can have their babies. It is safer. Like I always say, I want you and your baby 100.
Risk factors around carrying out a C-section.
Okay, of course, there are a lot of risks involved. Now, depending on the situation, there are various conditions that warrant people to do C-section. So if you are handling a C-section by virtue of a maternal high blood pressure, that in itself is a risk. So you are charged with the responsibility to keep both mother and baby. So you will have to manage the maternal blood pressure while keeping the baby alive, and you find out your balance between the two. Also, time is a factor to consider. Now, a lot of times people rush down to hospitals that they did not even register, and they just want results. If you are in that situation, know this, that once you didn't register there, now that person you are meeting did not know when that emergency came up. There are emergencies that can go south in minutes. For instance, rupture of the uterus. The moment a woman suffers uterine rupture, it's all a matter of minutes before she's gone. So if there's a rupture of the uterus and for this reason you referred, what do you think you're going to reap? You may actually end up losing both. So now, time is a factor because once the indication, meaning the reason, the need for the surgery arises, then time becomes your greatest enemy. If you don't rush, you're going to have a lot of problem. So these are factors we also need to consider. So if a woman is in labor, it is very important for every health professional around them to consider that time is of essence, and whatever decision needs to be made on time. At the end of the day, you get the mother and the baby alive, and that's all we hope for while managing them.
Processes and again the risk factors
Thank
of
you.
healing. I've seen some people, and I say, why does it take this longer?
A lot of reasons could be: one, infections; two, bodies could have poor healing processes themselves; three, when women go through labor, at times they could get so exhausted that natural processes are slowed down. And that's where prolonged labor is just the greatest enemy of delivery. Prolonged labor. You have stretched the whole system. All the organs are stretched out, and then they are fatigued, edematous, swollen, that even sutures are loosened and they break. Most of them are produced from what is called cat gut, the gut of cat, synthetic now. But it means that even sometimes while straightening them while operating, they cut, even while tying, and then I pull, they cut. So it's not something so strong. The tensile strength is not there, everlasting. In a matter of days or weeks, if that swelling doesn't resolve, it could go. It could break and give way. So this is one out of many factors that affects healing. But since we're talking about C-section today, it is going to be a painful procedure. Definitely afterwards, not during, but after. So pain will come, and then you give them pain relief, give them antibiotics so that wherever you cut can heal up faster. It is not the antibiotics that will heal. Healing is a natural process. There's a process the body undergoes to lay collagen and tissues across the scar to heal. Your antibiotics is just meant to make sure that no bacteria walks around the area where you operated, and then you keep the person safe.
Why the negative section?
Well, you've answered the question. Cultural. These are misnomers transmitted from one age cultural generation to another.
Any lady any woman that passed through Caesarean section, it seems to alter the body in such a way that most of these women don't get to lactate immediately after the child is being delivered.
All right.
What causes that?
Thank you. That can happen even with vaginal delivery. It doesn't have to be C-section.
Oh, okay. I thought the C-section has altered since it has altered the passage and everything.
No, it happens even with vaginal delivery. I've had people complain that they had to take a lot of water, rice water, whatever water it is, just to make the lactation come. So it's not a C-section. It may slow down a bit. Of course, some women may feel like we feel pain more than others. So if she's in so much pain, she's not able to breastfeed, the lactation may slow down a little. But it is not the C-section in itself that is the reason for the slow or delayed lactation.
How long does it take for a woman to heal?
Good question. The skin, I've seen 1 week.
1 week?
I've seen 1 week.
Heal,
yes.
And go back to work?
No. I've seen the skin close in 1 week, heal up in 1 week.
Closes from outside first and go in.
Inwards. That's 4 to 6 weeks.
4 to 6 weeks.
Yes, and that's why you see the puerperal period of puparium is 6 weeks, as it were. So in 6 weeks, the woman can be well healed from the scar of Caesarean section.
How long should the man wait?
I usually say give her 3 months. Let her heal.
And the man too should help her in healing.
Please, thank you, sir. Say that again.
The man too should help her in healing.
I hope you've heard, guys. Please help your wife to heal.
In cases of a C-section, what's the prevalence?
Oh, well, we don't have data for prevalence, and the reason is, as we speak, C-sections are holding all over the place in different hospitals for, of course, right reasons. So it has become more frequent. If I'm to say in terms of percentage, we have up to 40% of
the women opt for it now, even if they can do vaginal.
Yes, we've seen a couple of people who opted for it for work reasons.
Work?
Yes.
For work. Break it up.
Yes, for work reasons, because they don't want to be. I told you that prolonged labor is a problem. Yes, and the trauma of recovering from the prolonged labor, they just say, let me have the baby. At least in 6 weeks, I am fit enough to get up and go about my work. So they opt for it, just to go and to circumvent the pain of labor.
Your advice to women out there.
And to the men too.
And to the men too.
Okay, with the women, Caesarean section is not a disease. Yes, it's not a disease. Okay, and it's not an easy way out. It is not. It is a process on its own. It is a major procedure. And so if the need arises for it, please go for it. And there are no rule that says if you deliver through CS, you can't have a vaginal delivery. You can have your vaginal delivery after C-section if the initial reason for the first cesarean section is not recurrent in the index pregnancy.
But after two C-sections?
After two C-sections, please do not attempt to labor. Please do not attempt to labor. It is dangerous.
Okay.